St. Lucia's first rollout of its COVID-19 immunization campaign was promising, with an initial buzz from members of the public eager to protect themselves and to help control the spread of the virus in the community. The immunization manager, Tekla John Baptist, says the first phase of the program provided a solid platform upon which to build.
After this month, we had sort of scaled down. As you know, our first set of vaccines we had received just about 20,000 doses. Also, some other vaccines from our sister islands, bringing us to about 28,000 doses of vaccines in all. Once we would have covered our main target in the first phase, which would have been our frontline workers, our elderly population, persons who had very high risk, persons living with chronic conditions, we decided to scale down a bit in order to meet other persons who would have fell in that target group but not able to access the wellness centers. And as such, our healthcare workers were out in the various communities and into the various homes and institutions to reach out to this target.
Despite the initial successes, St. Lucia is still far off the 75% immunization rate needed to achieve herd immunity. For St. Lucia, that means 120,000 persons fully vaccinated. Herd immunity is the point at which a targeted percentage of the population is protected, thereby rendering an outbreak of the disease unlikely. The vaccination campaign is now moving into its second phase, during which some frontline workers will be fully vaccinated, while other at-risk workers will be offered their first dose.
In phase 2, we are reaching out to persons who are at medium risk. We have opened up to the education sector, transportation, commercial transportation. These persons, by nature of the level of interaction they have with the persons that they serve, they are at medium risk of contracting COVID-19, and as such, we are reaching out to them now. We are also in the process of rolling out our second dose. We have started, actually this week we're starting with our frontline workers. These were the very first set of people that we would have vaccinated, so we are doing it. It's a more targeted approach this week, where we go to the various healthcare institutions, fire service, police, and then coming the week of the 26th, we are going to be scaling up where we reach out to the rest of the population.
The vaccination campaign the world over has been impacted by negative publicity, fueled mainly through conspiracy theories, which has resulted in some adopting a wait-and-see approach. Those who lead the COVID-19 vaccination drive have argued that in order for life in St. Lucia to return to its former normal, St. Lucians will have to follow the example of more industrialized nations like the United States and the United Kingdom, and step forward to protect themselves and their communities by getting vaccinated. Stanley Lucien for the HTS News Force.